In the world of multiple sclerosis, MS, treatment, two oral strategies have emerged as frontrunners: Gilenya and Tecfidera. Both medications offer promising results in managing the symptoms and slowing down the progression of this chronic autoimmune disease. But which one is the best choice for MS patients? In this video, we will explore the differences between Gilenya and Tecfidera, comparing their effectiveness, safety profiles, and potential side effects. By understanding these key factors, MS patients and their healthcare providers can make well-informed decisions when choosing an oral strategy. Gilenya, an immunosuppressive drug, has shown impressive results in reducing relapse rates and delaying disability progression. Tecfidera, on the other hand, operates by modulating the immune response and has also displayed positive outcomes in clinical trials. As we delve into the details, we will assess the similarities and differences between these two medications, considering factors such as patient suitability, dosing regimens, and long-term management. By the end, readers will gain valuable insights into the advantages and considerations of each oral strategy, equipping them with the knowledge needed to make informed choices for managing their multiple sclerosis. Understanding multiple sclerosis, MS. Multiple sclerosis, MS, is a chronic autoimmune disease that affects the central nervous system, causing damage to the protective covering of nerve fibers. This damage disrupts the normal flow of electrical impulses between the brain and the rest of the body, leading to a wide range of symptoms such as fatigue, muscle weakness, balance problems, and cognitive difficulties. The exact cause of MS is still unknown, but it is believed to involve a combination of genetic and environmental factors. The immune system, which usually protects the body from foreign invaders, mistakenly attacks the myelin sheath, leading to the inflammation and scarring characteristic of MS. There are different types of MS, including relapsing remitting MS, RRMS, secondary progressive MS, SPMS, primary progressive MS, PPMS, and progressive relapsing MS, PRMS. Each type has its own unique characteristics and disease progression patterns. Oral medications for MS treatment. In recent years, the landscape of MS treatment has drastically evolved with the introduction of oral medications. These oral strategies offer convenience, allowing patients to avoid the need for injections or infusions, which were the mainstay of MS treatment for many years. Gilenya and Tecfidera are two oral medications that have gained significant attention in the field of MS treatment. Both drugs have been approved by regulatory authorities and have demonstrated efficacy in reducing relapse rates and slowing down disease progression. Gilenya, how it works and its effectiveness. Gilenya, also known by its generic name fingolimod, is classified as an immunosuppressive drug. It works by trapping certain white blood cells in the lymph nodes, preventing them from reaching the central nervous system and causing inflammation. Clinical trials have shown that Gilenya is effective in reducing relapse rates and delaying disability progression in patients with relapsing forms of MS. In a pivotal Phase 3 trial, Gilenya demonstrated a significant reduction in annualized relapse rate compared to placebo. The study also showed that Gilenya reduced the risk of disability progression over a 2-year period. Gilenya is taken orally once daily, making it a convenient option for patients who prefer to avoid injections or infusions. The initial dose of Gilenya is typically administered under close medical supervision due to the potential for a temporary decrease in heart rate, which can occur within the first few hours after the first dose. Regular monitoring of heart rate and blood pressure is necessary during the initial period of treatment. Tecfidera, how it works and its effectiveness. Tecfidera, or dimethyl fumarate, is a different type of oral medication for MS. It operates by modulating the immune response, specifically targeting certain immune cells involved in the inflammatory process. Clinical trials have demonstrated that Tecfidera is effective in reducing relapse rates and slowing down disability progression in patients with relapsing forms of MS. In a Phase 3 trial, Tecfidera showed a significant reduction in the annualized relapse rate compared to placebo. The study also revealed a decrease in the risk of disability progression over a 2-year period. Tecfidera is usually taken twice daily with food to minimize gastrointestinal side effects. The medication comes in delayed-release capsules, allowing for a gradual release of the active ingredient and reducing the likelihood of flushing, a common side effect that can occur shortly after taking the medication. Comparing the safety profiles of Gilenya and Tecfidera. When considering treatment options for MS, it is important to evaluate the safety profiles of different medications. Both Gilenya and Tecfidera have been extensively studied and have well-established safety profiles. Gilenya is associated with a few notable safety concerns. Due to its mechanism of action, it can potentially cause a decrease in heart rate and slow conduction of electrical impulses through the heart. For this reason, patients are typically monitored for 6 hours after the first dose to ensure their heart rate remains stable. Other potential risks include macular edema, swelling of the central part of the retina, liver function abnormalities, and increased risk of infections. On the other hand, Tecfidera has a different set of safety considerations. The most commonly reported side effects include flushing, gastrointestinal symptoms, such as nausea, vomiting, and diarrhea, and skin rash. These side effects are usually mild to moderate in severity and tend to improve over time with continued use. Rare cases of progressive multifocal leukoencephalopathy, PML, a serious viral infection of the brain, have been reported in patients receiving Tecfidera, although the overall risk appears to be low. Side effects and risks of Gilenya and Tecfidera. In addition to the safety concerns mentioned earlier, both Gilenya and Tecfidera have the potential to cause other side effects in some patients. Gilenya has been associated with an increased risk of infections, including serious infections such as herpes and opportunistic infections. Patients taking Gilenya should be closely monitored for signs of infection and advised to seek medical attention if they develop symptoms such as fever, chills, or persistent sore throat. Tecfidera, as mentioned earlier, can cause flushing, gastrointestinal symptoms, and skin rash. These side effects are generally manageable and tend to improve over time. In rare cases, severe allergic reactions have been reported with the use of Tecfidera. Patients should be educated about the signs and symptoms of an allergic reaction and instructed to seek immediate medical attention if they experience any. Choosing the best oral strategy for MS treatment. When it comes to choosing the best oral strategy for MS treatment, there is no one-size-fits-all approach. The decision should be based on a thorough evaluation of the individual patient's needs, preferences, and medical history. Gilenya may be a suitable option for patients who prefer the convenience of a once-daily oral medication and are willing to undergo the necessary monitoring during the initial period of treatment. It is particularly effective in reducing relapse rates and delaying disability progression. Tecfidera, on the other hand, may be a good choice for patients who prefer a twice-daily dosing regimen and are willing to manage potential gastrointestinal side effects. It is also effective in reducing relapse rates and slowing down disability progression. Ultimately, the decision should be made in consultation with a healthcare provider who can take into account the patient's specific circumstances and provide personalized recommendations. Other factors to consider in MS treatment decision-making. While the choice between Gilenya and Tecfidera is an important consideration in MS treatment decision-making, there are other factors that should also be taken into account. Patient preferences and lifestyle factors play a significant role in treatment adherence and overall satisfaction. Some patients may prioritize convenience and prefer the once-daily dosing of Gilenya, while others may feel more comfortable with the twice-daily dosing of Tecfidera. It is important to have open and honest discussions with healthcare providers to ensure treatment plans align with the individual patient's needs and preferences. Cost is another important factor to consider. The price of medications can vary depending on factors such as insurance coverage and healthcare systems. Patients should explore their options and discuss cost considerations with their healthcare providers or insurance providers to make an informed decision. Additionally, healthcare providers should consider the patient's overall health status, comorbidities, and potential drug interactions when selecting an oral strategy. Some medications may not be suitable for patients with certain medical conditions or those taking specific medications. Conclusion: making an informed choice for MS treatment. In the world of MS treatment, Gilenya and Tecfidera have emerged as two leading oral strategies. Both medications have shown efficacy in reducing relapse rates and slowing down disability progression in patients with relapsing forms of MS. When choosing between Gilenya and Tecfidera, it is important to consider factors such as effectiveness, safety profiles, potential side effects, patient preferences, and lifestyle factors. The decision should be made in consultation with a healthcare provider who can provide personalized recommendations based on the individual patient's needs and medical history. By understanding the advantages and considerations of each oral strategy, MS patients and their healthcare providers can make well-informed decisions that align with their treatment goals and preferences. With the right oral strategy in place, patients can better manage their multiple sclerosis and improve their quality of life.